So good afternoon, everyone. My name is James Lee. I'm the founder of the Microbiochip Diagnostics LLC, and also I'm associate professor from University of Texas at Paso. So I have more than 15 years in microbiochip fabrication and also biomedical application. So here we're trying to develop some new chip for disease diagnosis. And also our team has Dr. Sanjay Sharma and also Hamed for the technical for the chief technical officer, and also we have a couple of experienced mentors, including Les Stewart for our mentor. So what problem we want to address? So we focus on infectious disease. Why infectious disease? Infectious disease actually is a major. It causes a lot of global health issues. So think about it, in a year, it can cause 15 million deaths due to only from infectious disease. And also for this disease, it often happens in high poverty regions. So they don't have that much to afford high technique. So here I want to mention a couple of few infectious diseases, for example, meningitis. So you can see here, each year going to have about 200,000 people die due to meningitis. And also another one we are focused on is pertussis or whooping cough. So whooping cough is very contagious, and also it could be potentially deadly. So for each year, for example, globally it can cause 16. We have 16 million cases and about 200,000 deaths globally in children. So particularly it's very deadly for children and old people for this disease. And also I want to mention for this disease is the only vaccine preventable infection that remains endemic in the United States. Okay, we have the vaccine. You got the injection, you thought it's proof is a vaccine proof, but actually it's not. Okay, still cause a lot of issues here. And in 2012, we got about 50,000 cases. Actually, this is the highest cases since 1959, so it caused a lot of media attention too. So in that case, what's the solution? So we want to develop to address those issues, we also want to mention current diagnosis method. So for example, including bacterial culture and also the real-time PCR method. Those are conventional methods. They are either very time consuming. For example, bacterial culture takes more than a week to get your result. So, for this is infectious disease, so you have to wait for more than a week to see, what's going on. And then another method is qPCR, but however, this equipment is very expensive. So it costs around 60,000 US dollars. Okay, we did some research interview. We found even our El Paso hospital don't have this kind of equipment. Okay. So this is some issue for this problem. So in that case, we developed some microchip, very tiny, to address those issues. So this is a microfluidic, we call it lab-on-chip or microchip. It's miniaturized, it's very tiny, smaller than your credit cards. So here I have a demo. So you can see it's very tiny. So it just need a very small region, so it's low cost. You can design or based on your need. And also you can see very tiny, you can carry it all the way to anywhere. So it's fully portable. Okay, this is very important for infectious disease, but sometimes when the disease happens, you need some people to do the on-site detection. Okay, if you're interested, you can take a look. So and also it's very portable. So for example, here we developed the prototype. Okay, you can see this 3D illustration is very simple. Here we have 3 different units. This is for negative control, positive control. This is for whooping cough detection. So here you can see it's based on the side comparison. This is a photograph of the product. During the process, we also integrate a very specific genetic assay on the chip. So because we need the heating element, so we also use 3D printer, design and fabricate, integrate battery powered heater and analyzer. So everything here is fully portable, doesn't even require any electricity, so you can carry it ever to anywhere for point-of-care detection. And for detection, it's very simple, doesn't require very complicated process or personnel. So we just need, after the DNA amplification, you just use the UV light to shine a sample. Then you can use your cell phone camera to take photos, so you can see those results like this. Okay, you can see here. So this is an image taken by a cell phone camera. You can see here, this is our positive result, and this is the real sample, and this is the negative control. So, and also recently we developed an app to automatically recognize those different zones. And also we did a specificity test. You can see it's very specific. These three are very similar, so they can very similar pathogen, but they do cause different pathogen disease. So you can see B pertussis or B pertussis and homicide. So once we know what disease it is, then we can take correct treatment. So that's also very important. And also I want to mention here, our device recently has also successfully detected meningitis causing pathogen. Okay. Then we also attended the IS-supported corps for the market search. So we did 42 interviews. Those interviews including doctors, professors, lab technicians from different countries like US and Mexico, China, Nepal, and those countries. And we found our customer mainly from hospital, physician office, and diagnostic center. And from the interview, we also found people are looking for a price around 50, really need a micro device that costs around $50 instead $600 to $700. qPCR is the current commonly used method. For each test, it costs $700 US. So our device can only cost $4 for the fabrication material. So it's much cheaper. And our device is the only microchip for point-of-care detection of pertussis or whooping cough. And then, so in terms of the milestone, we got the product prototype, and also recently in collaboration with the Children's Hospital, Los Angeles, we tested 100 clinical sample. Okay, so you can see from the clinical test, it did validate our method. Our chip had pretty good performance. You can see the sensitivity is 100%. Okay, accurately detect all the cases, and also has a pretty high specificity as well. In terms of the financial analysis, we got a NIH grant earlier, about $500,000 to develop the prototype, and then later we got some other money from MC and also a Philips Foundation to optimize the device. Other than that, I also want to mention other direct costs, including chip fabrication, DNA assay, and also some salaries. So any cost is around $600,000. Then the revenue, we mainly come from the chip fabrication. You can see we have pretty big margin. So current price for real-time PCR is $700 US. So our cost, material cost, is only $4. So we plan to sell at $50, so we can get a revenue about 200,000 or 2.5 million in 2021. So in overall, so we expected to get a net profit from 2022. It's going to be at the beginning going to around 500 or $500,000. They're going to keep increasing. And also I want to mention here from 2019 next year we're going to plan to SBIR and then move to the FDA approval the year after. So, so in order to make it possible, I do appreciate need your generous support financially or technically. So thank you. So we're looking for about $500,000 investment.
Is that in addition to the SBIR?
We are also looking at some other opportunities other than SBIR. We're also looking for talking to some foundation right now. For example, here we have also American Clinical Laboratory Science Foundation. We're also talking to them.
Is that a grant or is that an investment?
It's a grant. Yeah, it's a kind of foundation.
Foundations you take equity.
They don't take
Okay.
credit.
They're not in this case.
Yeah.
Okay.
Yeah.
Thank you.
All right. Thank you, James.